want to thank everybody for coming today. We, the members, we're going to take it back for a second. We, the members of the National Shattering Silence Coalition Maine chapter, sincerely appreciate the opportunity yesterday to present our recommendations to the Commission studying the Lewiston tragedy. Our mission is to advocate and raise awareness about people with severe mental illness through education, outreach, and grassroots reform. It is an organization composed of medical, psychiatric, and social work professionals and family members of individuals who suffer from serious brain disorders. We have learned about the presently ineffective state of Maine's mental health system through personal struggle to help family members during times of crisis, which is why, though shocked and deeply saddened by the events on October 25th in Lewiston, we were not surprised. We have about 100 members now in Maine, and we've all struggled with almost impossible situations to help mandate treatment for those loved ones with anosognosia, which is a lack of awareness. What do we have to do? Robert Card's sister-in-law screamed at the police. Yet we talked to parents in New York, Michigan, and California. Wow, those states have just gone so far beyond us in treating those that don't think they need to be treated due to lack of awareness. The shortcomings of Maine DHHS that we're going to be outlining here today, we are respectively asking the Commission to broaden the scope of their work, to look at Maine DHHS and things that should have happened and didn't. There is a solution. It's called the Progressive Treatment Plan. The tragedies in Maine just keep happening over and over and over. Since Lewiston, and this is in Appendix C for your packets. Robert Jolly set his mother's house on fire in Richmond. His parents did escape, but the county sheriff in that Kennebec Journal article said that they had had 184 mental health contacts with him, and yet he was not court-ordered on a court-ordered plan because there's no collaboration. Another young lady in January set an apartment building on fire in Caribou, killing her boyfriend and displacing 21 people that did escape from that building. She since pleaded not criminally responsible. Robert McClure killed his girlfriend in Thompson after refusing care. Corey Hamill shot and injured a deputy sheriff in Androscoggin County in February. A young man in Portland just pleaded not criminally responsible after stabbing and killing somebody. And just we found out last night, the young man that was just shot in Dexter yesterday by police after attacking 2 policemen. He sought out, this was publicly reported in the television yesterday, he sought out mental health care the day before he was shot and was refused help. So our question is, how much longer, how many more cases is going to go on where people do not receive the care they need and they commit a homicide and then they plead not criminally responsible? And once you've pleaded not criminally responsible, then you're put on the PTP plan. Only after that. All these common denominators, all these tragedies have one common denominator: anosognosia, a lack of awareness of their illness. Dr. Skinner, head of the Maine psychiatrists, testified last year in the legislature that 60% of schizophrenics and 30% of bipolar have this anosognosia, lack of awareness of their illness. Now, I'm the sponsor, as a former state senator, of the Progressive Treatment Plan law, and in the timeline that you have on Appendix A in your packets, you can see that in August, when he had threatened his family, and in September when he threatened the reserve unit, Robert Card met all the qualifications to be under the PTP, Progressive Treatment Plan, court-ordered, supported program. So that he would have to do what the ACT team said and maintain a safe lifestyle. Now, this PTP statute has been much misrepresented, and that's why we had this chart made for everybody. And I want to take a couple of minutes just to go through this. It's so important. You can see at the top who can initiate a PTP district court application. One of them is a law enforcement officer, amongst an ACT team or a commissioner, administrator of a hospital. But it's got the A through G requirements. The patient suffers from severe and persistent mental illness. The family has documented that in Mr. Card's case for months and months and months. The patient poses a likelihood of serious harm. That's not an imminent threat. That's a different, lower standard. The patient has the benefit of a suitable, individualized treatment plan. That's something the sheriff, if trained, could have worked with the local Brunswick Act. A licensed and qualified community providers are available. Again, that could have been the Brunswick Act. The patient is unlikely to follow the treatment plan voluntarily. That's due to the lack of awareness. Remember, in August, he came home from New York with a treatment plan set up by a New York psychiatrist. He stopped his treatment plan, didn't think he needed to be on it. And to us, the fact that there was no follow-up by Maine's mental health folks to the mental health work done by the New York hospital, that's the real tragedy. Court ordered of compliance with F, help protect the patient from interruptions in treatment. And of course, we know that's the case because he had stopped his treatment. Compliance will enable the patient to survive more safely in a community setting, not in jails or hospitals. Now, my 03 statute, that original version of the PTP law, only could be used at the time of release from a hospital setting. But the 2010 statute, the outpatient commitment statute, which is this statute, you see that that is no longer part of the law. It can be used at the time of release from the hospital, but it doesn't have to. It can be used in an outpatient basis. And I'll never forget, we had a mother come forward back in 2009 actually. And she said her daughter, the first 7 times she had stopped the treatment plan, each time she'd had to be hospitalized. And she had just stopped it the 8th time. And she asked the question of the Health and Human Services Committee at the time, why do I have to wait 4 more months of hell getting her so bad that she's an imminent threat of harm before we can put her back in the hospital and re-PTP her? Why can't we re-PTP her the way New York was already doing at that time? Quicker, because we know what's going to happen. So that's why this law is worded the way it is now. It can be used in an outpatient basis. DHHS is clinging to the 2003 version of the statute, telling advocates and interested parties, oh no, it only can be used at the time of release from the hospital. That's why we had this printed to show that it's not necessarily the case. Now, yesterday, the reservist psychiatrists testified to the committee that they can't mandate mental health treatment in the reserves, and that's true. But Maine does have the PTP law that could be used. And so this redirection we're asking of the commission, we want them to focus on preventing the next tragedy. We don't want them to only worry about how Maine can react to the next tragedy quicker than we did this one. To us, that's counterproductive. What they should be doing is trying to prevent tragedies from happening in the first place. I'll now introduce Laura Snyder, who will do the next speech.
Need my glasses or I'm not going to hear a thing. And can you all hear me? If I can turn this down a little bit. Is that better? This is the one. Yes? Okay. Good morning. My name is Laura Snyder, and I'm a member of the National Shattering Silence Coalition, and also, like all of us, I have a family member, excuse me, with a serious brain disorder who has experienced a very long, difficult, dangerous process before finally being admitted into the progressive treatment program. While there, he's learned to use important tools. Now, he's no longer in PTP and is presently living safely without mandatory treatment. My family member, like 81% of the participants in PTPs and PTP-like programs, identifies his experience there as positive and hopeful, despite his initial resistance to the mandatory component of the admission. I want to talk today about a crucial part of our mental health process that is sadly lacking. A part that in Robert Card's case may have changed the course of tragedy. That is training of all people involved in the process of responding to a person with a serious brain disorder who is demonstrating dangerous and threatening behavior. So, not right now, don't pull it out, but in your packet is an Appendix A, and John already spoke about it a little bit. It's a timeline of the Lewiston tragedy spanning from May 2023 until the shooting in October 25. And it's separated into 3 columns. The incident, or what happened, the actual response, and what we call the PTP-informed response. And by that, we mean that what a responder could have done if they had been adequately trained. According to the 2011 statute of the PTP law, not only the superintendent or chief administrative officer of a psychiatric hospital can initiate a PTP, but also the director of an ACT team, a medical practitioner, a law enforcement officer, or the legal guardian of the individual while the individual is still living in the community. And that's key to the statute and to what we're talking about today. The process in making any serious mental health decisions are complex, and that's why education, training, and collaboration are so important. And this means that law enforcement officers, police liaisons, the local ACT teams, intensive case managers, and other involved mental health professionals have to be fully trained in working with people who are exhibiting serious brain disorder symptom escalation. The best decisions are always collaborative. And this collaborative approach was being addressed in Maine, even as the Lewiston tragedy was unfolding. In September 2023, Saginaw County Police Department was in the process of hiring a police liaison. Police liaisons who are trained in mental and behavioral health help share responsibility with law enforcement in making decisions on how to best and most safely respond and assist people in trouble. Comprehensive training is necessary, and it's fully within our grasp. On November 8th, when News Center Maine reached out to DHHS, about collaborative efforts to prevent or reduce the likelihood of tragedies like the Lewiston shooting from happening again, DHHS responded in an email, quote, DHHS is deeply committed to working with law enforcement and the community to support individuals with complex mental health needs and to protect the safety and well-being of Maine people. We were very encouraged by this response. But as of yet, no training has occurred, which is disappointing because DHHS Mental Health Bureau has the expertise to be a leader in this training. And we're not talking about training for some alternative approach we just cooked up. PTP is law, and it was established in 2003. That's more than 20 years ago. And the outpatient statute, allowing qualified stakeholders to initiate an application for a court-ordered PTP admission, was established as law in 2011. And yet, few stakeholders, when asked, even know what a PTP is. The core component of the 2011 statute is that the individual no longer needs to be hospitalized when the application is initiated. It can be initiated while the individual is still living in the community, but only if he or she meets very specific criteria. This is the difference between treatment before tragedy and reaction to tragedy after the destruction of many lives has already occurred. And this is the crux of good decision making. You can't make a good response to termination without collaborative and comprehensive training. So now I want to just take a minute and address a couple of perceived obstacles because some people think the PTP just isn't really applicable or possible. The first is the concern that initiating an application to PTP is too costly to already financially stressed departments and facilities. However, in 2023, an amendment was made to PTP law stating that all PTP application-related costs will be reimbursed. Another voice concern, and this is more recent, and I'm sure you've all heard it, is that Robert Card has posthumously been diagnosed with brain injury. So now the question of PTP and adequate mental health response regarding the Robert case incident is no longer relevant. Well, a simple common sense analysis only shows how ridiculous this statement is. In a treatment response, we can only make decisions based on what we observe and what we know at the moment. Now, no one would advocate that the best way to treat Robert Card would have been to wait for him to murder 18 people, injure 13 more, and then kill himself so a diagnosis could be made based on an autopsy. I mean, that's crazy. The word we don't use. It's ridiculous. Furthermore, as a person who has worked in a community-based program with people with brain injury, and I have for 20 years, mental illness and brain injury are not exclusive. They are frequently co-occurring disorders. Many people with brain injury exhibiting the kinds of dangerous and erratic behavior that Robert Card exhibited benefited and continue to benefit from psychiatry, ACT teams, other mental health interventions, including antipsychotic medication. Those who do not respond to their mental health treatment on their plan then engage in further testing that might include brain MRIs or CAT scans, so diagnosis and treatment can be fine-tuned. The process of diagnosing, treating, and goal setting is ever evolving. In Mr. Card's case, A reasonable response would have been to stabilize the setting, keep Mr. Card, his family, and the community safe, and then, at least by August, or if not August, September, to have at least initiated a PTP application. But for this to have happened, all personnel would have had to have been fully trained. They were not, and the application never occurred. As all of us who have experienced living with or being around people with serious brain disorders, we know that to only consider removing Mr. Card's guns is short-sighted and only minimally addresses a very complex and much larger issue. For those of us who have been with people with serious brain disorder and anosognosia, or lack of insight into their condition, during the times of psychosis, we know that that person, based on his or her hallucinations and delusions, believes that violence is necessary. He or she will utilize anything: axes, knives, arson, assault, and cars as deadly weapons. You only have to look at local newspapers to see that all of these have been used by people with serious mental illness in our state in the past few years, and many within the past few months. And often, people with serious brain disorder resort to suicide. Once homeless or living marginally, our family members have often been the recipients of violence and exploitation by others. So, the thought that gun laws in Robert Card's case could be considered a solution without addressing mandated treatment only underscores how vitally comprehensive training is needed now and in our state. Thank you.
Hi, my name is Joe Pickering. I was director of community accounting services for 30 years. We had the first PTV program with John Nutting leadership as a senator in the state of Maine. And even though I had a lot of experience, maybe close to 50 years, etc., I never knew much about anything about serious brain disorders until my son had schizophrenia. And you don't get it at age 10 or age 19. It's an inherent neurological, biological, prior to birth situation. And it's, in a sense, well, it destroys the brain eventually in the teens. So what is necessary for Maine? Maine needs to wake up big time. This was a wonderful article in the Bangor Daily News that says treatment program at center of debate. The problem is, why the hell are we debating it? Look here. There are so many states either approving or they've already approved many of these states, including a number of them in New England, and pending. Where is Maine? It's nowhere except in pain. Maine is in pain, and that is really a great tragedy, a beyond tragedy, because it places all of us endanger both those that we loved, those that we once loved, those in the community. When Chris passed away, he died in a fire. He had anesthesia. We were not able to get him help. He was given, he was treated very well and in terms of services with CHCS as well as the Department of Human Services. However, unless given the main laws at that particular time and now, we were not able to get him more intense services. So the net result was Chris ultimately passed away, and it endangered the lives of people living above in the second floor. Thank heaven nothing happened. But what we're saying is, for God's sakes, end this stupid, cruel, inhumane situation. And I think the Governor Mills, who I think, in my opinion, is chiefly responsible for blocking these efforts, needs to begin to bring us all together rather than keep us all apart. And furthermore, how could you do that? By having a committee of all those who supposedly are opposing these programs with those who would like to see them, and bring in speakers from outside of Maine, such as the former judge from Michigan, who had an outpatient first program, which was accepted by the advocacy groups, and the great legal framework. Maine is backward, and I know we don't want to hear that because we think we're first in the nation. What we're first in the nation is not doing what we ought to be doing. Also, I would like to have one more comment regarding the Maine congressional delegation. They could take the lead in terms of ending this nationwide, at least try to take the lead. They have done nothing. They have shown all kinds of expressed compassion. But the problem is, hearts and flower leadership is not true leadership. And that has got to stop, and they should be working together as a unit to try to get a bill through, or at least help sponsor a bill to end this terrible IMD exclusion law, which has been killing Americans since 1965. There's tremendous amounts of information about it in terms of the number of people that died as a result of this particular law. I can give it afterwards, etc. But it's unnecessary and it's cruel. We've heard a number of people have spoken about here about the delay. Why in hell are we delaying? Why is Maine so backward? It is because of political and fear and unnecessary fear. We need to have leadership at the state level, true leadership, as well as true leadership with our Maine congressional delegation. Thank you. Oh, by the way, one more thing, one last thing. The last time I spoke, I was in the audience and John Nutting was here and he asked me to come up to speak. This was months and maybe a year ago. And I said I would for $1. And he pulled out $1 and I took it. He was astonished. And I want to give you, John, because you've done such a wonderful job over the years. Here's your $1.
Good. Appreciate it.
One thing we want to do with the IMD waiver monies, which is probably a net $10 to $12 million for the state of Maine, paid for by the federal government, like all these other states already have, is more ACT teams. We need an ACT team in Eastern Maine and in Belfast Rockland. We desperately need an ACT team in Presque Isle, Caribou in Northern Maine, and Norway and Farmington in Western Maine, so that the PTP law can be used more, because we need those community supports. You don't have a PTP unless you have the community supports as part of it. So more than happy to answer any questions that you might have for us, and we can, I know we've got many things going, Channel 6 got a little late, but we can back up and fill you in on what you missed. Any questions for us? Yes, sir.
Can you go over the IMD payment exclusion? I feel like that's the one part of this I'm not following.
Well, the 1965 law was a federal statute that said that you can't use federal Medicaid monies for any hospital larger than 16 beds, and a bunch of other restrictions too. It's why New Hampshire and Vermont have already exempted themselves for it, and Massachusetts and New York and New Jersey have applications pending to do the same thing. It's about a 10-to-1 federal match. We'd have to put forth about 1.3 million to gain 11 to 12 million, and we want to use it to strengthen community resources so we can keep people on a treatment plan, but keep them in the community. We don't want a loved one in hospitals and jail. We want them to be supported in the community. So every day somebody's checking and make sure they're taking their treatment plan. And let's get you a job. Let's work on substance abuse. Let's make sure you have a nice apartment. PTP is an overall, it isn't just a medication compliance. It's lifestyle, get a job. No, it's to try to turn people's lives around. It's in your packets there also. There's some National Institutes of Health data that shows that it's close to a 90% improvement in lower rates of hospitalization, lower rates of jail time, all those types of things we family members have seen when we finally had our loved ones put on the PTP program.
So sorry, just to make sure I 100% understand it. The idea here is that moving forward with this waiver requires Maine to put up a certain amount of money, which then
make an application, yes.
which brings in a lot more federal dollars, and then you can use those federal dollars to build up community support.
Yes. State Senator Baldacci sponsored LD 445 last year. We were so pleased and encouraged. It passed unanimously. It was a Health and Human Services Committee #1 priority for funding. And then it was killed with appropriations. So we have to start the process all over.
I'd like to just make a comment in terms of the economic cost to the America, and I'm going to try to do it from memory. Schizophrenia in the early 2000s had a great economic, never mind the human cost, which was tremendous, had a greater impact than all of the cancers in the United States combined. In 2019, schizophrenia had the economic negative impact to our economy than Alzheimer's and even diabetes, of which two out of every every 5 Americans have. The Treatment Advocacy Center has a lot of statistics in terms of having the law itself, just retaining this law itself causes all kinds of, I think it was 50% of the mass killings. It contributes to suicide. This federal law. We're paying for a federal law that contributes to the deaths of Mainers and Americans. What the hell are we doing? And we should be outraged at our leaders who sit back and say, Well, it's basically, it's not our priority. And if serving America in this way is not our priority, then they shouldn't be in office.
Any other questions?
So you sent the letter to the commission, have you had a chance to actually speak with them?
No, we were told that the only way we could make recommendations to the commission was in writing. And we felt strongly that the public needed to know what we recommend. So that's why we have the press conference. Yeah.
I should go to Dan after this.
Yeah, I understand.
But I guess everything training that the coalition thought about correction law enforcement agencies individually and simply training them. That way you don't need to rely on everything else, which is obviously taking multiple years to move ahead.
I did just receive because we wanted 3 half-day training sessions, so it's not allowed. One with the sheriffs, one with the chiefs of police, and one with the district attorneys. And the district attorneys have reached out to me, and I haven't informed everybody, but they would like to have a training session with us because they're seeing that they'd rather, it would be beneficial to put somebody under a PTP program than to put them in jail. It was actually the sheriffs that came forward in 2010 who were my co-sponsor, State Senator Peter Mills, and myself on this bill, and said, look, we want to be able to initiate PTP because we have hundreds of people in our jails that are there. We get them stabilized, we release them back to the public, they stop their treatment plan, and one sheriff said, I can set my calendar and almost predict to the day when they're going to be back in jail. One young man kept going off his treatment plan. He would tear the headlights out of his neighbor's car, hunting for the FBI cameras that were in there, and bang, he was back in jail over and over again. It'd be better off to have law enforcement initiate a PTP, assign them to an intensive case manager or a group home or an acting community, keep them on a treatment, and keep them out of jail. That's all we're trying to do.
Police and sheriffs haven't responded to you about you?
No, they've told me that they would prefer to be trained by the department that works with the law all the time, and we understand where they're coming from.
Public safety.
Right. No, they'd be prefer to be trained by the Mental Health Bureau, the HHS, that works with the statute.
DHHS says DPS is usually in charge of training law enforcement. That's what they told me last year.
Yes, but the law enforcement would still prefer to be trained by the department that works with the law every day.
So is there just confusion over who should train them?
No, I believe there's a refusal to train. There are some very strong groups that don't want anybody to be ever PTP'd. Are you taking their rights away if you order them a treatment plan? If I had $1 for every time I've been told in 21 years since I passed this law by these groups that it's someone's right to be psychotic, and they believe that. If I had $1 for every time I've been told that, I could buy a lot of funerals, a lot of flowers. And so that is really affecting, in our opinion, the lack of adoption of this statute. I mean, the situation at Caribou, thank God it wasn't. But that could have involved the death of 21 people in that fire. That's bigger than Lewiston. That family has struggled for years to get a loved one on a treatment plan. Couldn't do it, set the fire. Now she pleads not completely responsible, which is an accurate plea. Now she's on the PTP plan. She shouldn't have to commit a homicide before you can get on that. Any other questions?
I'd like to just make one comment about the some people who oppose because they don't want to, they think fearful they're going to be placed in the jail, or, I mean, in hospitals, et cetera. I believe that many of the people who are opposing it, I'm sure have serious problems. There's no question about that. But what we're talking about is a smaller group of people who have anosognosia. And that's extreme, schizophrenia really could be a whole series of illnesses. We're so backward in terms of understanding these illnesses. We've had actually a 4,000-year history of the Egyptians first started to try to understand some of these illnesses. It's difficult, so a lot of these people really don't have the illnesses that they're now advocating should not be treated. And that is really unfortunate. And so I think a bringing together by Governor Mills and, quite frankly, the Maine congressional delegation in terms of education, to bring in people such as, if it's possible, the judge from the Michigan, Michigan has a very advanced, it's called the outpatient first program. That meaning treatment would be provided at the outpatient level. And it wouldn't be immediate into an inpatient program or anything like it. But it has a legal framework. Maine's legal framework is, at least during the time when Chris passed away, was hideous. It contributed to his death. That's why my wife and I want to speak out. We've got nothing to lose. We've already lost. So we've got to get together and motivate our politicians to move their rump.
Any other questions? I do want to close by saying, go Celtics. Thanks again for coming. I know there's another event at 11 o'clock. Some people had to leave early. We can stick around and get some more questions. I want to get a package from Carol.